Hello and welcome to our weekly virtual town hall to discuss COVID-19. Like usual, if you have questions, you can add them to the comment stream, as well as email us at covid19.questions@chw.coos.or.us. We're not going to have our slideshow presentation this week. We are going to just work on addressing questions we've received since our last meeting. Today joining us, we have Kelly Dion, Brian Leon, and so that I don't sound like a Dr. Seuss book, Florence Portal Stevens. So we will get started with our first question. All right, you ready?
We're so ready.
We are ready. Margaret has asked, I have an inclination to give blood next month, but I'm wondering how safe that is, not for me as much as for others. If one is asymptomatic but has the virus, won't the virus be in their blood, and then if mixed with other bloods, be a contagion eventually to many people? In other words, doesn't having COVID-19 affect one's blood, even if blood drive health workers take donor's temp, or the donor has no cold or whatever, they could just be asymptomatic. What are the facts about this?
So you're really kind of getting at a couple of different points with this question. One of those is what bodily fluids can contain enough of the virus to be transmitted to someone else and to cause infection. Right now, we're only certain about respiratory fluids in mucus. It is true that we haven't absolutely ruled out other fluids potentially, but right now we still consider those pretty low risk. More specifically, the question about giving blood, we feel confident at this point that the American Red Cross has set up plenty of protocols and screening, and if there were any concerns about any individual giving blood on the day they arrived, that they would address those as an organization. But right now, there has not been any indication that there's a problem with giving blood at this time.
All right, anybody else have anything to add to that? No? Question number two. Question number two has a couple of questions. Kevin says, on the childcare maximum of 10 children per room, how does that work for a large building? Does that mean if a building is large enough, lots of rooms, that you could possibly have 50 plus? We'll start with that one.
Well, hold on. I have the order in front of me, so I need to decipher it a bit. So what the orders say is page 7 of order 20-12.A under point 16. Childcare must be carried out in maximum stable groups of 10 or fewer children. Stable means the same 10 or fewer children are in the same group each day, and in a classroom that cannot be accessed by children outside the stable group. So the way I understand this is that if you, as a childcare provider, have the amount of rooms necessary to have various groups of 10, and the logistical means necessary to ensure that those group of 10s will never be in contact with one another, I think that would respect the order.
Hmm.
There were, yeah. So this is how I read that. And also, of course, following the usual rules of childcare provision, and what I'm discussing here is, of course, number of teacher per children. Make sure that there is an access for all those groups, for bathrooms that are going to be like one facility for this group of kids, unless the facilities are thoroughly clean between the groups and all that. So I mean, logistically, I mean, I think it's feasible if you have the logistics for it.
Sure. His other question has to do with recess part of daycare. Understanding that if you have 2 rooms with a wall between them, 10 kids in each room, 20 kids, that would be feasible because you've separated them by a barrier of some kind, and you're maintaining what the guidance would say with 10 people. But what happens outside? Now, I would assume it's the same.
Yeah, what you have to ensure is that it's very clear in the order that that pretty much the different stable groups cannot be in contact with one another. So what it means in my mind, at least, is that you would have to stagger recess.
Mm-hmm. Yeah.
And you might have to also clean the recess area between recess times.
As far as like playground equipment and things
Yeah.
like that, you'd want to disinfect it because you don't want cross-contamination.
Yeah. But this is just, this is what I understand from what I'm reading.
Right.
You know,
Well, and that's
not, it's just my personal understanding here. I'm not speaking for the governor's office.
you can only go by what the guidance says, and if you take it very literally.
And I would add a couple of thoughts to that. Obviously, we're speaking explicitly about the governor's order at this point. Remember, the whole point of the governor's order is to limit the amount of contact that multiple groups are having with each other and to maintain social distancing. So the issue isn't necessarily just how much room do we have.
Mm-hmm.
It's what will happen. So people coming in and out of the building, even if they leave at different times, are they coming into contact with surfaces that a different group has come into contact with? And that's what Florence was talking about in terms of, disinfection and things of that nature. Yeah, it sounds like potentially, a setup of 30, 40, 50 kids with separate cohorted groups could potentially be handled, but that is a lot of logistics to work out. And we appreciate our daycare providers, childcare providers. They're doing heroes work all the time, and especially so now. But we got to think of, how simple is that going to be? It sounds simple enough if you just talk about it, but in reality, how are we going to keep those kids apart, especially just, like I said, the stuff that they touch? So something to consider.
It's a very good point.
And I will add to the consideration list the availability of disinfecting
Agents.
agents.
Yeah,
Yes.
it is harder to get
Because
hold of.
it's been I know it's been a concern for daycare.
Absolutely. Mark Healy's asked, and Mark, thanks for joining us again. You had a lot of great questions last week. If COVID-19 cases are late in showing up in Coos County, should we be social distancing for a longer period of time? Will our peak be later? Great question.
The simplest answer to that question is yes. Our peak will be later. I think going into a little bit more detail though, because of the fact that, theoretically we've had no cases, even ones that maybe have not been detected. That situation where we've already begun pretty drastic social distancing before it even starts, basically in that kind of a scenario. And so it wouldn't even just be the fact that the peak would be later on, but perhaps even just shorter and the curve would be smaller overall. That would be the hope. But then again, we don't necessarily know because of, testing limitations that we've had to deal with, that there hasn't already been community transmission in the area. So that's, that kind of muddies up that scenario a little bit. But yeah, it certainly kind of depends on, how we're able to handle these social distancing requirements and whether everyone contributes and cooperates. But we should certainly see a lower curve overall and definitely a later peak. Hope that helps.
Well, here's a very interesting question, and I think I'll answer this question. How are the people at Coos Health and Wellness holding up? I think that what I think you don't understand about the public health division of Coos Health and Wellness is that when it's time for their call to action, they pick up and do real yeoman's work. I mean, the effort that's been put forth by those individuals involved with this response is unlike anything you've seen outside of probably the military. For myself personally, the community partners coming together. We have Kelly from Barry Hospital here. The ability for the community to come together to work on a response to try to ensure the safety and health of our community is something amazing to witness. And it's a lot of work and it's a lot of hours and it's very stressful and it's very hard on the staff here, but it's what they signed up to do, and they're doing it with such professionalism and ease. It's pretty amazing to watch. So we'll just keep plugging along. So as long as it takes to make sure that all of this comes together. And I know that the community has done a great job banding together to try to support each other, support our healthcare workers, support our restaurants. It's really something to see in a small community like this, that everybody can find a way to move the needle in the right direction and try not to take too many steps back. So thank you for that question. All right. Once Florence stops crying, we'll be able to.
Thank you for the question.
That's a great question. Peggy asks, I'm not clear on parks and our beaches. Are they still open to the public?
So we had an interesting discussion with our lawyer. Do you want to summarize this?
Sure. So obviously, folks in the governor's office and various advisors that are helping out with some of these orders are, really working around the clock to put these together and to try to make sure the public is safe. But they've had to do it in obviously a very quick and expedient way. So there certainly are a couple of things we understand the public has questions about. So one thing our council told us earlier was essentially things like walking and hiking and that type of recreational activity is not something that is prohibited explicitly. Obviously maintaining social distance. So, a big hiking group in a cluster, that would not be something that we would be okay with. But, people in pairs or threes or whatever, as long as they're maintaining social distance, that's fine. However, in a different part of the order, there's also talk about the fact that all non-essential travel should be eliminated. Meaning, if you are still able to work, depending on the business, commuting to and from work, going to get food, other, essential supplies, that is the level of travel that we're currently expected to respect. And so coming back around to the beach and parks and things like that, on one hand, we're supposed to be able to use those in the method described, but on the other hand, we're also not supposed to drive 15 minutes non-essential travel or 10 minutes or whatever to those places. So it could be interpreted to say, hey, if you can walk to those areas yourself, that would be within the intention of the order. But if you cannot, driving to and from those locations would be outside of the intention of that order. We know that's not an ideal explanation, but based on what we have available to us, that is what we have to use right now as far as our advice.
Thank you, Brian. Lois has another question. With Coos County's demographics, we have an older population, a poorer population, poorer health. We could have a higher COVID-19 mortality rate. What are our thoughts?
I think that in the older population, we do tend to see worse outcomes for that group. They tend to come into this with comorbidities and things they're already struggling with, and unfortunately they just can't handle that type of illness the way that younger and healthier people can. So I think looking at our demographics for this county, we would anticipate seeing a higher mortality rate.
Yeah, and from an equity lens, our community is with the poorer, population, and they significantly would normally have poorer health outcomes, right? Because they have a lower socioeconomic status. It could be hard on the community, which is why the community's tried to band together so strongly as far as the healthcare partners go to try to ensure that we can keep COVID-19 out of Coos County as long as humanly possible. So I think that that's at least something that I've seen in the minds of those individuals that have been coming together to talk about it. Christina said, will public transportation be affected?
So public transportation, that being able to conduct that inside the boundaries of social distancing, I'm not really sure that that's possible.
Right.
And honestly, this is an excellent question, just because there are certainly folks in our community that are dependent on that type of transportation. So other than saying, yeah, that would make social distancing pretty difficult and would certainly be a very hot point of high touch surfaces that would certainly increase the risk of transmission. We will absolutely make a point to look into this to see if there are other alternatives and other options that we can explore to help people that depend on that kind of transportation. That is an excellent point.
Yeah, that's a tough one.
Yep.
It really is.
Yep.
Barbara has a question. She's wondering why temperatures are not being taken as an effective screening measure for people entering public spaces. Like some of the medical facilities have started doing this, right? But not all of the people that are serving the community are doing that. Do we have a mindset, do you think, as to why that is?
We've been trying to talk to a lot of community partners. We haven't reached out to everybody yet. I think this is a fair question at this point. I think it is possibly a good thing for us to consider, possibly bringing even like the grocery stores together and see what could be done. I know for our organization, we didn't own the no contact thermometers, so they are on their way.
Mhm.
And so that could also explain like not having the proper equipment to conduct that screening.
Yeah,
Was it Barbara?
it was Barbara.
Barbara has a good question here.
Melissa has asked in our thread, why are we not stopping our big grocery stores from letting so many people in at once? There's no way to social distance in Walmart. So I wonder if she's suggesting that the grocery store should have a limit of how many people are in the store at a time, or
Yeah, I think this is going to go with the previous question, in my mind at least. I think for us having that conversation, I think I don't want to be mistaken, but I think I read somewhere, like either in Europe or somewhere else, that some grocery stores have been doing this, actually, limiting the number of people who are getting in so that they can ensure social distancing.
And of course, there are a couple of different issues that could go along with that. Obviously, if that were to create some type of queue, that could also be a social distancing hazard outside. There would be a few different variables that we would have to kind of take a look into as far as our guidance. But right now, the governor's orders as far as what businesses can remain open doesn't offer any caveats as far as limitations to the number of people that can enter a building at one point. If you're allowed to stay open and do business, that's essentially the threshold of what those businesses have to pay attention to as far as orders. Once again, that's a really good point. I don't necessarily have any immediate solutions to that, but it's certainly worth looking into and talking with some of those larger stores, especially the high traffic stores.
Absolutely. Thank you, Melissa. I'm pretty sure Costco is doing it. People aren't doing it. So Lynn emailed us and has a question regarding the homeless population. Said that without their ability in some cases to refund cans that they relied on for food and money, and they can't rely 100% on the Devereaux Center. What are we doing to try to address the homeless population?
Okay, well, that's a great question. So I think the homeless population, along with the most vulnerable in our community, have been one of our focus from the beginning of our preparedness and response planning. So we've put together, along with all of the community partners, a homeless task force that has been convening twice a week, that is really looking at two main strategies. How do we prevent COVID-19 from entering the homeless population, and then if or when COVID-19 gets into the community, how do we ensure that people without a home can self-isolate and be taken care of. On top of that, there's been tremendous effort on the part of the food share at Orca to really ensure that foods are available to folks in the various food pantries. And Laura was telling us yesterday that they've seen an uptick definitely at the food pantry. The Devereaux Center is providing lunch, I believe, on a daily basis, or at least multiple times a week. I know the Harmony Church has a lunch on Saturdays. College Park, I know, has just canceled their Saturday breakfast because they were having a hard time recruiting volunteers, since the volunteers are from the kind of like more at-risk population. So this is what's been going on that I know of.
All right. Brian, did you see this one here? Lois asked it. She's been trying to find infection rate per capita per state information, but not finding any. Is there a link for that? Is that something maybe the CDC or?
No. Well, I mean, you can certainly see and find the cases for each state at the CDC, and you can also then in turn get information on the census website in regards to what the population for that state is. So if you look up U.S. Census data online, you can find out what that denominator would be, and then find out the case rate. I want to be really, really clear. That's not the same thing as the infection rate. The cases are obviously just infections that we have detected. And so certainly not in an infection rate. I would also kind of add to that if you're looking at a state by state value, that is probably not as relevant as it might sound, only because transmission is going to vary through different communities quite a bit differently depending on population density and behaviors of the community. You know, there really are a lot of factors to go through if you're trying to kind of get a sense of risk here in our county or in some of our individual towns. But yeah, it is certainly interesting information, and as an epidemiologist, I always encourage everybody to start checking out data like that. It's really, really handy. You'd be surprised to find what kind of information is out there.
That hurt. Mark's got a question. How many COVID-19 patients can Coos County hospitals handle at one time? And how many ventilators, face masks, et cetera, do hospitals have? And will these numbers improve?
I can speak for only Bay Area. We currently have 9 ventilators. We have 19 negative pressure rooms and the ability to expand that. We currently have 12 ICU beds, but there are contingency plans in place to expand our ICU capabilities as well. We do have some equipment on order. This has, if it's taught us anything, it's taught us not to count our chickens before they've hatched. So we do have equipment on order that we have not seen yet that will allow us to take BiPAP and CPAP equipment and transform that into a ventilator should that become absolutely necessary. It's not ideal, but it would help us through in a pinch. So when that equipment is received, we'll have a total of capacity for 20 ventilators.
Thank you, Kelly. There's some questions regarding North Bend Medical Center's shutdown, and I know, do you feel comfortable answering those? I know that ICC is still open as far as North Bend Medical Center goes.
Yes, that is correct.
We have a couple questions. One asked if we could get a better explanation for the shutdown. And then Karen wants to know what happens with the long-term, I guess in long-term care, LTC residents.
Yeah.
Okay, so what I can try to communicate is what I was hearing at one of the meetings we were in this morning. So the rationale behind NBMC, and they're not really shut down. They are operating as a skeleton team at this point. They are, from what I understand, so the first reason why they did that was, they didn't feel comfortable putting well patients in a space where they could possibly be exposed to COVID-19. So that was a big point in their decision, and they wanted to play their part in the social isolation requirements. I've lost my train of thoughts. Bear with me a second. So what was also communicated this morning was that they are shifting their visits to a telehealth model.
Mm-hmm.
So that's happening. And the immediate care clinic remains open at this time.
All right. You got more?
Well, I would just add to that. So because of that, because we're not talking about a full shutdown. We're certainly not aware of any barriers to attend to issues for residents in long-term care facilities. To be clear. That's it.
That was wonderfully poignant. So we have a question from Steve, who says, we had a question on our voicemail from someone that was concerned about the spread of COVID through mosquitoes.
Yeah.
And we got communication yesterday,
It's a couple days ago.
a couple of days ago,
Yeah.
from the Oregon Health Authority that got their information from the World Health Organization.
All right.
And it says, to date, there has been no information nor evidence to suggest that the new coronavirus could be transmitted by mosquitoes. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. So that does not.
Okay.
So that is all great, but it kind of goes back to what we were talking about earlier about, we're only right now feel really comfortable about respiratory droplets being the medium for transmission of the virus. We don't necessarily know that there could be any potential infection with blood, which I think is probably what is inspiring this question. So yeah, we're not concerned at all about mosquitoes. I know for some folks they're going to say, well, it's easy to say it's not mosquito season, but keep in mind there are parts of the world where it is mosquito season, and the virus has been making the rounds around Earth, and so if we're getting this information from the World Health Organization, I feel pretty confident that that's the case.
All right. Crystal asks, at what level temperature do I need to go in? Is there a specific temperature you should be looking for? Is it just a temperature in general? Kelly's ready to rock and roll on this one.
Yeah, handle it, Kelly. Get it.
I think that a numeric cutoff for a temperature is a little bit too narrow.
Mhm.
Just because you have a temperature doesn't necessarily mean that it's linked to COVID, or that you necessarily need to seek medical care for it. If you can stay at home and sip soup and take medications to make your fever more comfortable and kind of livable, then that's what we would advise you do. If you are having a medical emergency And so if that fever is causing you to hallucinate or become overly dehydrated, if you're having difficulty breathing, those are the things that you need to be seen for. I do want to kind of remind people that the vast majority of people who contract COVID-19 are not going to need medical care. With that being said, you'll just like flu probably feel pretty miserable, but seeking out medical care isn't necessarily, we won't necessarily be able to do much for you. We don't have a whole lot in the way of treatment. And, but again, with that being said, if you're having difficulty breathing or, you're unable to stay hydrated, we definitely want to see you for those things.
All right. Thank you. Melissa has another question. Says, I have a pregnant family member in her second trimester that works at the hospital. Are pregnant women in the high risk category?
So at this stage, first of all, with any new illness, we're of course concerned about pregnant individuals that are exposed to new illness. I kind of hate having to bring this up all the time, but there's very little data so far on pregnant individuals, except for the fact that there has been some case series studies that seem to indicate that it is not being transmitted from a pregnant person to their child. It is a situation where, again, I'm not comfortable saying that's just the way it is, and we're totally fine with pregnant people being exposed, but there doesn't seem to be a point of concern right now. It's certainly something that we'll keep following. Also keep in mind that different exposures and different issues that we deal with people that are pregnant, that sometimes has a different level of concern for when in their pregnancy stages they are, and since obviously folks that are just in the first 4 or 8 weeks of pregnancy, with this being a fairly new illness, there may be a lot of people out there that have been exposed that don't even know they're pregnant yet. But as time goes by, hopefully we get stronger and stronger data. Just at this point, there's does not seem to be a point of concern for that.
Oren would like to know how many actual COVID-19 test kits are in the country right now.
In the country or in the county?
Let's say county. It says county. I just can't read.
Okay, so I believe I forwarded Oren
Okay.
the inventory as of last week.
Probably the same question.
Yes. So the answer that I can give you right now is that there are not very many tests at this time in Pierce County that are available, and that we are asking providers to focus the testing to certain profiles and higher risk populations.
All right. Christina has a question. How is COVID-19 different from the flu? Feels like that's right in your ballpark, Brian.
Maybe a better question is, how is it the same? That would probably be a shorter list. So, I mean, obviously some of the symptoms, some of the vulnerable populations, the flu and COVID-19 have in common. I know early on when we didn't have a lot of experience with this here in the States, there was a lot of chatter about comparisons to the flu. A lot of that possibly just because some of the symptoms are similar, but there really is not much else of a comparison there, especially just considering the fact that one massive dynamic that's different is the fact that, you know, we have a lot of folks that are vaccinated against the flu normally every year. And so, you know, usually, again, I think I said this a couple of weeks ago, there's really just kind of a scenario where, of course, not everyone gets vaccinated for the flu, but typically the people that are spending a lot of time around individuals that are particularly vulnerable to the flu do tend to vaccinate themselves as an added buffer. So with no immunity in our population, the dynamic of transmission and the severity of the illness for those who are in the more vulnerable populations is quite a bit different than the flu. The mortality rate is a lot higher. You know, how hard it hits those vulnerable populations is, you know, seems to be harder. Yeah, if anyone is still under the pretense that this isn't too much more than a bad flu, I really urge you to reconsider that position.
All right. Brenda has some questions that she's sent us throughout the week. Let's see which one. So first question was, there have been media reports that Oregon health and safety professionals don't have enough supply, such as gloves, hand sanitizers, etc. What is the situation here in Coos County?
Well, I'll start and Kelly can follow, I guess. Sorry. So the situation is not very good. Let's be real. We, through our public health emergency manager, Philip Nell, have been able to put resource requests through the Ops Center quite a few weeks ago to be able to get some PPE from the Oregon stockpile. So we've received and distributed according to the prioritization metrics that we were provided with to our partners from hospital, clinics, first responders, police and sheriff, and other community partners. As of today, the Oregon stockpile is dry. We know that Oregon has
They've requested some federal assistance, right?
Thank you very much. Yes, they have. You might have seen a request for people who sew,
Yes.
to help us
So many posts.
sew some masks. And Kelly, do you want to discuss this a little bit more?
Sure. So our situation with masks is, again, not great. We have masks right now. We have put strategies in place to make those go further. And so again, that's not ideal. We've asked our staff to extended use their disposable masks. And, you know, of course, if they get dirty or torn, somehow contaminated, we need to dispose of it appropriately and grab another mask. But we've put that in place anticipating this wave of patients that we're likely to see. And we want to make sure that when that wave does come, we have stuff for our staff to keep them as safe as possible. And, you know, hopefully we get a shipment in and everything goes off okay. I think we've come to see that we can't really rely on our distributors that well in this kind of environment, you know, and not just our distributors, you know, here for Coos County or Bay Area, but we're seeing that across the entire country. People are not getting what they would normally get. And so these distributors have put hospitals on what they call allocation, which means we can't order more than we would normally have ordered. And we're getting a percentage of what we order. And so we can order all we want to order, but it just back orders, and then we wait in line just like everybody else. We have been really, really touched by the way the community has come alongside the medical community to spend time and energy and make homemade masks for our healthcare professionals. That is not a situation that we really ever want to be in, that we're issuing masks that aren't considered standard. But, you know, when push comes to shove, that may be the situation that we're in. Realistically, we may be asking that of our medical community. And so, again, we're just so appreciative of the efforts that are going into helping our people stay safe, well, as safe as possible.
You know that the community, those individuals that are actively working on that have started their own Facebook group.
Really?
Yeah, it's pretty cool. It gets shared a lot on some of the more regularly traveled or trafficked pages, and you've seen that pop up, and I think it's neat. It's one of those things that if I can't sew a paper bag together, probably, but those individuals that have that talent and have the time to do so are putting an effort in to try to help the community. And that one of the questions that Brenda had was, apart from taking sensible precautions for our families, what can the public do to help? The public is helping. And there, not only that, but there was a question about deliveries. There's a group that is on Facebook that is just to try to help other people get their groceries that can't get out to get groceries. They can't feel like they can't get to the restaurant to get food or can't make food, that they will deliver things to them. So it's just about the community is banding together in small pockets of whatever they can help to do to try to help other people in this time of extreme need. And I think
I think it shows what Coos County is made of.
I agree. Bella has a question. If we do have to go outside, as when we need to walk the dog, should extra precautions against the COVID-19 be taken up on return home, such as taking off your shoes, since the virus can survive on surfaces for a while?
I don't necessarily know that places where we're walking are necessarily the type of high touch surfaces that public health officials are mostly concerned about. We're mostly concerned about things that you would potentially touch with your hands and then potentially later touch your face with. So, I mean, yeah, I'm not concerned. I mean, I have a dog. I walk him, you know, several times a day. I am certainly not taking my shoes off before I come back into my place. Oh yeah, grocery store. Again, as far as your tennis shoes go, we're less concerned about the surface you're walking on than the surfaces that you are touching with your hands and that later could potentially touch your face. I hope that
Right.
helps.
So maybe in that particular, those two particular examples, we could say, wash your hands upon return, disinfect the dog leash on a regular basis, right, with some wipes of some kind. When you come back from the grocery store, wash your hands. I think removing your shoes is just I don't know, a general hygiene thing that you might want to do, even without COVID-19 being around.
If it will give you a little bit more sense of security, by all means, do it.
Absolutely. I had read some things, people talking about a very similar topic where they will go home and they'll take a shower when they go home.
Yeah.
after being out for the day, instead of doing anything else when they get home from work or wherever. Right to the shower, take a shower, change their clothes, put their stuff in the dirty clothes. If that's a regimen that you want to set so that you feel like you've taken the day off of you,
Right.
so that you can enjoy being home, why not? Melissa said she's been making masks for several days. Melissa, thank you
Thank
very
you,
much.
Melissa. Thank you to all of you that are making masks.
That is amazing stuff.
I wanted to jump in. So earlier I saw a question that kind of went by that was asking about hand washing stations that they had heard about in other
Porta
areas
potties
of the state.
for the homeless camps. Yeah.
Yeah, that is definitely something we've been working on, and getting hand washing stations out to those sites. Yes.
I was going to circle back to that, but thank you, Brian.
Yes, circle back now.
Well, we've circled. The circling has been done. We've circled back. Brian's answered the question.
So what I wanted to add on this
Yep.
is that so as part of, like, we have a lot of partners on the homeless task force. We have designated some areas of high traffic for the homeless community, and so those areas have been provided with hand washing stations. We have a few more available. So if people, know of places we haven't been thinking about, right now we're very much focused on the Coos Bay North Bend area. But if there are like some congregating places in South County, for example, that could use a hand washing station, let us know.
I'm gonna take a little detour on the same topic. There are places that, like, say you work at a location and that location's bathrooms seem to be out of order, and now you have porta potties outside. And so in porta potty use in general, is it safe for the communities to be using porta potties? Like disinfection protocols for porta potties. Is there one?
Not that I am really aware of in terms of one that is consistently followed.
Right.
I would definitely try to ensure that you had every opportunity of washing your hands and any other surfaces that may be touched by surfaces in the porta potty. And in this case, we're not just talking about COVID-19. We're talking about
Just in general.
any number of communicable diseases, the flu. Well, I'm not going to do a laundry list. I hope you guys know that that type of setting would certainly be a concern if you were not to manage your hygiene accordingly after using them.
So you'd want to use hand sanitizer, probably wash your hands as soon as you have the ability to do
Right,
so.
but then let's say on the facility front, the facility that is using the porta potty, I think there are also some steps they can take in terms of regular disinfection of door handles, and
Sure.
even the hand sanitizer delivery machine.
Yep.
And the porta potty in itself, right? Especially if it's highly trafficked.
Yeah, if you're a place of business that has to utilize those because of maybe a plumbing issue or something like that, you're going to want to take the onus on yourself to ensure that the precautions are being taken to ensure the safety of your staff and consumer, I would imagine.
Oh, yes.
Brenda has another question. Said, since older people ages 60 and up are at higher risk for developing serious COVID-19 illness, and a big part of that population is age 60 plus, and since pneumonia is a common and potentially deadly complication for those with COVID-19, can we ask insurance companies in our area to cover the pneumonia vaccine as prevention for age 60 and up, even though the CDC recommends 65?
So what I did with that question, Brenda, is that I forwarded it to the Oregon Health Authority to put a bug in their ear. And so I think I forwarded it yesterday. and I received an email letting me know that they are working on routing this to the appropriate agency. So I think it's a good question. We'll see what they say.
So we have a more formal question or answer hopefully soon.
Yeah, no, that's a really good question. Although to be clear, pneumonia is kind of a catch-all term for a lot of potential different infections. Pneumococcal vaccines protect against a spread of very common ones. This is not a vaccine that would protect you against COVID-19, although it would certainly be nice to be vaccinated against the other more common forms of pneumonia, just so that you wouldn't have to potentially get hit back to back with a couple of different types. So,
And I think that that's what she's leaning towards. Like,
Right.
would it make sense for preventative so that they're not already fighting an uphill battle, but
Right.
then they get another rock to push up the hill?
Yeah.
So
Yeah.
it would be
And
harder.
this is also one of the reasons why there's a recommendation for folks who haven't been vaccinated yet for the flu this year to vaccinate, so that they do not have to have a morbidity?
Comorbidity, right? A co-infection. That would definitely make recovering an uphill battle at that point. I think she means, where can we get a vaccine?
Yeah, your primary care, I would imagine. Does Walgreens still do those?
A lot of
pharmacies.
pharmacies do offer vaccines. It does kind of depend usually about whether their particular insurance would cover out of a pharmacy. Most of them do, I believe. But yeah, that is, is actually something we were talking about yesterday in terms of some of the normal kind of upkeep of our health, since a lot of primary care providers are kind of shifting towards telemedicine and things like that. How do we ensure that things like vaccinations are still available, because they are still very, very important. So that is something we'll certainly be keeping an eye on going forward.
Patty had a question for individuals that may have to go door to door for their work. Is this something that, even though there's no positive cases in Coos County, is it a concern for those individuals? Should they be concerned?
You take that one.
Okay. So in those times of social distancing, I think it's very important to keep in mind that if you feel comfortable, keeping on conducting your work, you might want to really look at maintaining social distance between you and whoever's house you're visiting. And I would say definitely touch as little surfaces as possible. Wash your hands on a regular basis. Carry hand sanitizer if you can find some. And be mindful of maybe somebody, if someone is experiencing some of the flu-like symptoms that we're talking about with COVID-19, you might want to reschedule. One of the things we did as an organization before we decided to go to mostly telehealth was to talk to folks ahead of the appointment and do a on-the-phone screening for symptoms. And if they had symptoms, we reschedule that appointment. So that could also be an approach.
Yeah. All right. Well, we're going to ask this one last question from Melissa before we go. Even though we have had no positive case from testing in Coos County, are we to believe it's not in our county yet, or is it here and we just don't know?
I would lean towards the second
Mhm.
option. You know, yeah, for sure. There is community transmission in the state of Oregon. There is community transmission pretty much everywhere in the world at this point. That would be really amazing that if there were no community transmission in Coos County. But, you know.
Almost feel like we need to ask this question.
Okay.
Okay, sure.
Are we putting our store's cashiers more at risk by bringing our own grocery bags from home? I'm not doing it now. I would prefer to just buy a bag. Should we stop asking people to bring a shopping bag?
So
That is a
an-
very intriguing question.
That's an interesting question. The one thing though that I witnessed over the weekend in one store was that you could bring your own bag, but you were asked to bag it yourself. So
Huh.
pretty much what they were doing, I thought was very interesting, was that minimizing kind of like the contact of the cashier with anything else but the items you're purchasing.
Sure.
And they also had a hand sanitizer pump right there. And so I was like observing the person and they were like sanitizing their hands like pretty often. I thought that was a pretty interesting protocol. To tell you the truth.
Well, that's an interesting question. I'll be interested to see how this develops in the next week, because I think that's something that not a lot of people think about, this big transition. Okay. It's been fun. We are going to wrap up our weekly virtual town hall. Please don't forget, if you have questions that you'd like us to address next week, to email us at covid19.questions@chw.coos.or.us. Also, you can follow along as we go on these and ask us questions as you've seen so many do today. I want to thank Kelly. I want to thank Brian. I want to thank Florence. And most of all, I would like to thank Barb over there making it happen for the ASL translation. So until next week, everybody stay healthy, stay safe. Have a good rest of your week.